Hello everyone, this is Dr. Kim. In today's video, we're going to take a look at an example of mucous retention pseudocyst. This has also been referred as antral pseudocyst, antral cyst, mucous retention cyst. So just keep that in mind. These can be referred using a different terminologies depending on where you practice and how you're trained. Mucous retention pseudocyst can be captured and seen in any of the paranasal sinuses. But in dental settings, since most of our scans will go up to about maxillary sinus for dental implant cases, you will likely see these in the maxillary sinuses. This particular patient had CBCTs taken in order to evaluate the maxillary implants that have been placed in the past, and mucous retention pseudocyst was incidentally discovered from this scan. So now, as I scroll up and down in this axial view, you can see that for the most part the left maxillary sinus is grossly clear, and however, when we look at the right maxillary sinus, there is this dome-shaped radio opacity, both in the axial plane as well as the coronal plane. And we can see that in the sagittal plane as well. Let's take a look at its behavior or effects on the surrounding structure. As far as I can tell, it hasn't caused any mass effect on the surrounding structure. It doesn't appear to be that it's causing the perforation of the walls. It hasn't caused any sclerosis or neo-osteogenesis of the adjacent bony structures. It's just sitting on the floor, floor and posterior lateral wall of the right maxillary sinus. And most of you will encounter this mucous retention pseudocyst on your panoramic radiograph. And while I cannot obviously completely recreate how this would appear on panoramic radiograph, if you look at this sagittal section, I think that's it's going to come pretty close to it. So you're going to see in the posterior mandibular region of the right maxilla, you're going to see the floor of the maxillary sinus, and there's going to be this dome-shaped radio opacity on panoramic radiograph. Important distinction from this mucous retention pseudocyst from other benign tumor or cystic lesions that can occur within the maxillary sinus is that it does not have a corrugated border, which indicates that this is a condition or lesion arising within the sinus rather than having something growing within the alveolar process and lifting up the floor of the maxillary sinus as a result of its growth and expansion. So that's something I want you to note. And if there were teeth in this area, testing for vitality would also be important. However, in this case, the patient is edentulous. So given all the radiographic features and the consideration, this is definitely a mucous retention pseudocyst, and I hope to once again go through this in 3 different planes. And lastly, axial. Alright everyone, hope that was interesting, and I'll see you in the next video. Thank you for tuning in. Bye.